Hello, David Ansara here of the Centre for Risk Analysis, where we help you to identify risk in the current environment, to prepare for an uncertain future, and to prosper tomorrow. As South Africa is in the midst of its sixth month of economic lockdown, questions are being asked about the efficacy of lockdowns. And I'm joined today by Advocate Mark Oppenheimer, who is the author of a new book called Lockdown: Did Government Do the Right Thing? He's co-authored it with Jason Werbeloff, a philosopher and a novelist. Mark, welcome to the CRA channel.
Excellent. Thank you for having me.
So Mark, if we wind the clock back to February of this year, governments around the world were faced with a conundrum. They could either let the COVID-19 virus pass through society with unknown consequences and effects, or they could impose varying degrees of lockdown on society and on economic activity. Could you take us through the process, the dilemma that many of these governments faced and how they acted?
Well, we must remember at the time that the view from the World Health Organization was that the mortality rate of the virus was roughly 3.4%. And if the ordinary mortality of something like flu is 0.1%, the view was at the time this is 34 times more deadly. There was also a precedent set by China, who had instituted a very hard lockdown. And then we had these visceral cases of hospitals being overwhelmed in Italy and Spain. Videos of doctors weeping after having been on 72-hour shifts, dealing with people who were, where they didn't have enough ventilators. And this really signaled to the rest of the world that this is a serious thing and we need to take strong measures. And that's why lockdowns were introduced. Now, the purpose of a lockdown is sort of complicated. So to my mind, we must think about the kinds of people that can be affected negatively by COVID-19. So first of all, they're the people that will contract it and will be asymptomatic. They will experience no symptoms whatsoever. The second set of people who will contract the disease but won't need hospitalization. The third are people who will contract the disease and whether they get a hospital bed or not will die. And the fourth are those who will contract it, need a hospital bed, and if they get one, will survive. And it's really only that last category of people that you can help with the lockdown. The original purpose of lockdowns really was to safeguard medical resources, to ensure that there was a sufficient number of beds, and you would ensure that you don't have a healthcare system that is overwhelmed. You could never really eradicate the virus. That was not an option for South Africa and for most places in the world because we're interconnected. The rare examples of eradication strategies are places like New Zealand, which are islands on the far-flung regions of the world, and they have taken an eradication view. But that means instituting, closed borders until a vaccine, which may be, more than a year away. And that obviously has very severe economic consequences and social consequences.
So now, Mark, turning the focus to South Africa, in spite of this very onerous lockdown that we've had, we've still recorded 650,000 cases of COVID-19, but only about 15,000 deaths. So one has to ask the question, are lockdowns actually effective in doing what they're supposed to do, i.e. limiting transmission of the virus and ultimately reducing deaths?
Yes, I mean, in South Africa, the concern is that you have people who are unable to be locked down. You've got people living on top of each other, people who required mass public transport. Discovery have put out the view that it's not 650,000 people who've been infected, but rather 13 million. In other words, 20 times the figure. So if it's 20 times, then the implication is that lockdowns did very little in terms of stopping the spread. Now, we haven't had a situation where our hospitals have been overwhelmed. But one of the questions we need to ask ourselves is, what were the costs of instituting a lockdown that is still ongoing? And we've had a 51% quarter-on-quarter contraction in our GDP. I mean, it is cataclysmic. That's roughly 750 billion rand. Now, Discovery, through a rough estimate, thought that 16,000 lives might have been saved through lockdown measures at a price of around 46 million rand per life. Now, there's some sense in which, all lives are sacred and we don't want to allocate rand values to them. But if you are running a public healthcare system, we do that. We do work out how much money we put into treatment, how much money can be, spent on dialysis machines, or subsidizing cancer treatments. There's also another cost of lockdowns, which is purely measured in the sense of lives. So there are people who died because they could not get access to their medicine. There are people who had chronic TB or HIV and required medication, people who needed cancer screenings who didn't get that and are going to die or have already died. And we see that in the excess deaths figure. In other words, we've had more deaths that can be explained merely from COVID. So this kind of cost-benefit analysis is vital for governments to have done, and it's not clear that South African government has done it properly. At a moment when it was clear that the virus was a lot less deadly than first thought, Discovery now take the view that we're talking about 0.3% mortality, so a tenth of that which the World Health Organization initially conjectured. And we still have an ongoing lockdown, which is devastating businesses. We've had all sorts of other strange anomalies that seem not at all connected to health, like a ban on cigarettes, or a curfew, or a narrow exercise window, or a ban on e-retail. So government has undoubtedly taken this opportunity to grab as much power as possible as it could in South Africa. The other thing we have to think about as South Africa is that we don't have $3 trillion like America has to ameliorate the negative effects of closing down businesses forcibly. So Americans receive checks, businesses got bailouts. In South Africa, some money was gathered, and some of that money was stolen or involved in sort of illicit tender deals in corrupt PPE scams. So we haven't been able to ameliorate a lot of the negative effects of the lockdown. And this was something that was known by government. So Alex Broadbent, who was the Dean of Humanities at the University of Johannesburg, said we can't have a one-size-fits-all approach. African countries are not European countries. We don't have the money to ameliorate these negative consequences, and we should be a lot more wary of lockdowns. And instead, South Africa instituted one of the toughest lockdowns in the world, and then arrested citizens and intruded on their rights for all sorts of things. 300,000 people were charged with breaking lockdown regulations for breaking curfew or walking their dogs, or a number of other ridiculous things.
So Mark, recently on the CRA channel, we had Pete Leroux of Business for Ending Lockdown advocating for the complete removal of the state of disaster, as well as a lifting of all of the lockdown protocols. What would your position be on this matter?
I think given that we now have so much more information than we originally had, that the virus seems a lot less deadly than expected, government can take a different role, which is an advisory role, to say, these are the things that we think will help stop a spread. It's not clear that the existing measures have stopped the spread if we're looking at 13 million infections, but that they could provide advice and then allow society to continue. You might want to ensure that those that have comorbidities or those that are very elderly, heed that advice. But the consequences of stifling the economy will result in people dying and will have health consequences for many years to come. We shouldn't be just measuring lives lost, but years of lives lost. And some estimates have put that at, I think it was 14 times, if you just calculated years of life lost, the cost of lockdowns. Now, some sort of costs in our economy are not just from lockdowns. We have to recognize that it's from the disease and from the fear of the disease. It's not just because government has said you cannot operate. But we wouldn't be sitting with the kind of economic collapse that we are faced with now if we didn't have a government that had been so zealous in enforcing lockdown rules.
Well, Mark, thank you very much for sharing your insights with us. We're looking forward to reading the book, and we'll link in the description below, so anyone who would like to give that a read can do so. That's it from me, David Ansara. Remember to like this video and subscribe to the channel, and also do check out our 30-day free trial where you can access all CRA research and analysis. Until tomorrow, take care.